So we have come to the last leg of this APAC National HealthTech Innovation Conclave, perhaps the last session, but very important session. It will be a panel discussion on digital upskilling, health workforce for the digital future. We heard in the inaugural session, a lot of speakers talked about what about managing human resources. And to manage human resources, the need of the hour is whether our human resources are skilled enough or upskilling is happening to the needs of the hour. So this session will obviously discuss about that. For that, I would like to invite eminent speakers from the hospital chains, but also there'll be an industry presentation before the panel discussion starts. So I'll first invite the moderator of this panel discussion, Dr. Kousar Shah, Senior Vice President, Max Healthcare, to come on stage, please. A huge round of applause for him. Dr. Ashish Chaudhry, Managing Director, Aakash Healthcare Private Limited. Dr. V.R. Gupta, Group Medical Director, Sarvodaya Healthcare. Yes. Dr. Karan Thakur, Group Lead Sustainability and ESG and Vice President, Indraprastha Apollo Hospitals. Dr. Karan Thakur. Dr. Ashish Shukla, Vice President, Operations and Strategy, Regency Healthcare. Let me invite Colonel Binu Sharma, Senior Director, Nursing, Max Healthcare. Colonel Binu Sharma is here? Okay. Welcome you, ma'am. Let me invite Kawaljeet Oberoi, Group Chief Nursing Officer, Paras Health. Let me also invite Captain Sandhya Shankar, Corporate Chief of Nursing, Fortis Healthcare. Is she here? Yes, we welcome you. We are also joined by Dr. Ashutosh Srivastava, Medical Director, Aditya Birla Memorial Hospital. Dr. Ashutosh Srivastava. Yes. And we are also joined by Rahul Dutta, Chief Operating Officer, Fernandez Hospitals, units of Fernandez Foundation. And with this, I hand over the session to Dr. Kousar Shah, Senior Vice President, Max Healthcare, for the panel on digital upskilling, health workforce for the digital future. Over to you, sir.
Thank you so much, and a warm good evening to everybody. But my two questions to the organizers first, not the questions, just two lines basically. The first line, thanks for allowing us to be here. But the second line is even more important. How much time do we have? 40 to 50 minutes. Okay, because accordingly we'll basically position ourselves. Okay, fine. So guys, आप लोगों में से भूत किसने देखा है? Anybody who has ever witnessed a ghost? I'm not talking about myself. Don't look at me like this, please. Nobody? I'll give a small story about this. So many years back, there was a new hospital coming up in Gurgaon. It was in the construction phase that time. I was pretty new to the management that particular time. I had just shifted from clinical to the management. I got an opportunity from there and just trying to explore something which was coming up new. Without understanding what is the profile, what is the detail, what is the organization, I just jumped into it. वहाँ जाके मैंने भूत देखा. Hospital was supposed to be, it was in construction phase, it was supposed to be a different type of a hospital, and I realized this much later after getting into it. वहाँ जाके मुझे पता चला this hospital is going to be a paperless hospital. Being a doctor myself, we have never been taught about what is IT, what is computer, and what is computerization. When I saw my table, which was basically it was a desk which was given to me, it had a huge something like this lying there. I was told, this is computer. This is the only thing you will be working upon. There is no paper here. When I looked at it, I actually felt like I am looking into a ghost. And that ghost was all over the organization. Everywhere it was paperless organization. I don't want to name it basically. But the point is, I really used to be feeling मैं भूतों के बीच में चल रहा हूँ. I had no knowledge about the computerization. But then, of course, I had to take it up because I was into it. So I had to take it up. I started doing some classes and all. I picked it up. So if I share this with anybody today, nobody will believe this because I've completely shifted from that to being a tech savvy or whatever you want to call it. I don't believe in paperwork anywhere. I just believe in soft copies. But till that particular time, I had no knowledge what is a hard copy. I had no knowledge what is a soft copy. From that particular day, if I look at this today, imagine we are talking about digitalization today. Digitalization is many, many, many steps ahead of what I experienced many years back. Now, when we look at the digitalization in healthcare, actually, if you see, it's very gorgeous. Not just that, it's actually very seductive for every C-suite person. All the CEOs, and everybody is basically bowled over by this. They want to have it. And everybody has been trying to have it. They all have been grabbing it for the last many years. I mean, every organization is trying to run after it. But the point here is, and I think that's the reason why we all are standing or seated here, the utilization of digitalization is not even 35 to 40% in any of the organization as of today. The point which I want to make from here is like, despite having digitalization transformation in so many organizations, the real ROI is yet to be achieved. There is a huge cost to it. And when I look at from the P&L perspective or from the finances perspective, it actually pinches. But the point which I again want to say here is, the ROI is very much there. But the point is that we are not able to achieve it. The biggest challenge that we face in achieving it is nothing else but the marriage of the technology and the sources which are doing it. And that's why we are standing here. That's why we are seated here. We have I think one of the most powerful panel towards the end. Probably it is to hold you guys back and your attention as well. And I think we are definitely going to do this. So that's what the challenge is. How do we do this? That transition from a stage where most of us who are still into the healthcare, maybe bearing the latest people who are coming into the healthcare sector. So most of us who are standing or seated here are not or have not been taught about IT or digitalization in our college days. But we had to transition. But we are just about 2 to 5% in any organization. Rest of the entire organization is still lying the same way. That's why the ROI is still not achieved, but it is available. It's available in the systems itself. So just trying to understand that challenge, how we can shorten this challenge, how we can shorten this distance. We all are here, and I would actually like to throw the first question to Dr. Ashish Chaudhry, our speaker here. Like, in terms of key digital skills and competencies in healthcare, what are the key challenges that I believe if you can make all of us understand from professional perspective that the professionals face because of which they are not able to transition into it?
Thank you, Dr. Kousar, for kick-starting the session, giving the context of this current panel. Having said that, I have got, myself also transitioned from somebody who was writing paper prescriptions for 20 odd years. And then I was forced to, transform myself, get onto the EMR and start ordering onto the system and devote 80% of my OPD consult time on looking at the system rather than the patient and answering to the patient while typing simultaneously. So that transformation was quite difficult for any clinician, just like me. In fact, that was forced upon me because nobody else would follow unless I will follow. So every clinician I found that had a huge amount of resistance in that kind of change. All this last 7-8 years, we have been trying to get on board one and the other consultants from various specialties onto the digital. And now, especially after the COVID, when they realize they are not able to interact with the patient one-on-one, and they're able to carry out the COVID treatment either through giving teleconsults online or trying to put the orders on the EMR application and the order getting executed far distance even while they are Either they are in quarantine, or they are sitting at home, or they are traveling. So that was some area where they found some utilization or some merit in getting transformed digitally. So that actually brings to the point that healthcare, there are two parts. One is management, which Dr. Kousar just mentioned. The management is all after digitization, but do they really go to every consultant and ask, whether they are comfortable in that? Definitely, the first answer will be no. We are happy the way we are going. New age, Gen Z doctors, if you see surgeons, they are happy using the apps. But if you talk about senior consultant, who are the actual business drivers, you can't force them to get onto the system unless you sit with them, look at the merits of the system and also the advantages they can have in the patient care. So anything which brings about improvement in their surgical care, medical care, bring about improvement in the patient experience, and patient comes back and reports that yes, the system has helped me, even follow the advice while you are busy in the OT. So these are the few advantages or the merits which a senior clinician can get. So that kind of connection or the marriage, you can say, the management and the clinical team or the core team has to make so that everybody gets on board. Even now, most of the AMRs we have in market, nothing is perfect. Only thing is you have to adapt to the EMR or change your process to fit into a particular type of EMR, and it is evolving by the day. Yes, we can't compare our systems, our patient education level with the Western world. They are far ahead in technology. But if you talk about Indian doctors or Indian healthcare system, with that much of OPD load and that much of patient influx in the hospital per day, I think we do a fantastically better job as compared to our Western counterpart in terms of even diagnosing a disease in 3 minutes or even with the gait of the patient walking inside an experienced surgeon. So those are the areas which nobody else can match. But if we add on a technology part, if we add on some real merit and advantage of adopting digitization, I think that's the key which every healthcare institution should focus upon. As a manager, I would want everybody to use the entire EMR, but that's not the reality. Even if I look at my own system, 30-40% is the total EMR which is being used by clinicians. But even then, it brings about a lot of change. So I think the crux is that one should keep on evolving every day. One should keep on going back to the consultant, looking at their problems, and the IT team can help with the management and sit with the doctors and find improvisation and solutions for improving the patient care. So a lot of things are in the market, whether it is IoTs or telemedicine, teleradiology, everything has got some advantages, but yes, you have to look at the clinical significance, improvement in patient care. If that is the end result, I think ROI is definitely going to come, but it will take some more time.
Thank you so much. And I think, this is a classical example of leading by example, what Dr. Ashish just said. Now, he being a clinician himself, he being the head of the organization, since he's doing it 100%, the implementation in the organization is much huge. But at the same time, he just mentioned that it is about 40%. Now imagine a place which is not being headed by a person who is so tech savvy, so pro to it. What would be the condition of that particular place? That's exactly what the challenge is. So the next thing which I want to ask is to maybe Captain Sandhya, you can just flex your muscles. It's coming to you. So you know what? One way can be that, as Dr. Ashish just said, he has to lead by example, keep training, retraining people. But the other way, and this is the organization which he's heading and leading himself, that's why it is there. But many other ways it can be an organization which wants it to be tech savvy, but they don't want to do this what he's doing. They just want to boom, 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 keep throwing all the things on the people who are working. You need to do this, you need to do this, you need to do this. May or may not happen. Now my question is to Captain Sandhya. What would an organization do in such a scenario where they want everybody to be tech savvy, want to be working on the digitalization? What support or system you can develop where everybody becomes pro to it and the organization gets the benefit?
Thank you, Dr. Kousar. Probably, laying hands deeply on day in and day out on operations. I want to thank you for asking this question from me. And two things, which flashed to the mind, and a message to all the administrators and the organization owners and the implementation heads is launch, roll out to trust your people, not to control. This is the first point. Second is build constellations, not the stars. Now, having said this, and this is loud enough when we want the ground people or the frontliners to be aligned with a vision or the project or the ultimate aim the organization has envisioned. We fail, we collapse when everybody in the chain is not aligned that yes, EMR has to be rolled out, up and sailing and rocking in the organization. Starting from a staff nurse or a technician till my head of department is seeing the same form, same template, and using the same information, where is it passing through multiple screens and translates into a prescription or a summary, gets handed over to the patient. How do we do it? We train. So training certainly helps, but where is the attitude? So along with the training, before everything, when we plan, we are dreaming a project, we are conceptualizing a project, the planning and the budgets are the thing which goes at the forefront. Now, while we plan and we budget, involving the people from the front line have to be there critically, when the critical decisions are being made. So this is now number one. First is with trust and respect, involving people from every cadre who is going to contribute to the patient journey directly or indirectly, be it from biomedical engineering or the nursing or the administration or the process owners, so on and so forth. Second important thing is cascading the goal and the vision to everybody way before the final launch. This is the second thing which is important, because sensitization towards the goal is, it makes the people aware and aligned to the intent. Third important thing is working on the infrastructure and creating mock rooms or, for the drills, for the people to get used to and people to have sensitivity towards what is coming in for me. Fourth one is rewarding and recognition and probably communicating in a better way on small wins. And there goes the master trainers, along with this, the champions. Now, this process is known to everybody. Probably everybody who's sitting in this hall or outside embarking on these journeys and digitization plans. Thing is, how do we implement it and how do we make it happen? And how do we sustain the traction throughout when the confident user is there to make my vision and make my intent happen? So this is what probably, it's not a management jargon, it's experience, it's intent and attitude when we don't want to lose the traction. Of course, keep collaborating with the teams, not in silos, and moving on. So that's all I say.
Thank you so much, pretty well said. And just a small question to what you just said. What could be the right approach for the organizations when they're selecting a person? Should that be at the time of selection, that they should be only selecting tech-savvy people, or it should be an approach where the people are there, taken into the system, and then there is a constant training going for that?
Not necessarily. You don't have to hire tech-savvy people. It's the attitude which matters. You just said that. You were at ground zero. Today you don't, accept.
But I had to face
everything.
a ghost.
Yes.
मुझे भूत का सामना करना पड़ा.
Yes, that's what was the attitude which brought you here, right? I won't say we can assess the attitude, we can build attitude. And there comes the collaboration, because collaboration, trust, belief. And I said purposely, build constellation, not a star. So
thank you. You appreciated me, so I'm dropping the question here. Thank you. Thoda has lo yaar. So guys, I know, I can understand. That's why I'm trying to give them more laughter actually. So the next question is for you only, Binu, because you spoke in between. So the question is, what can be the potential benefits for three components in terms of healthcare? One is the employees, the people who are, the professionals who are into the healthcare organization. Second is the patients. The potential advantages for digitalization from the professional's perspective, from the patient's perspective, and the third is from the overall organization's perspective. Can you just put some light on that?
Thank you, Dr. Kousar. Interesting question. And there are multifold benefits. I think let me just start listing for the organization first. The organization leadership is very passionate. They want to implement the entire digitalization in the new hospital or existing hospitals. They have dreams. They want to showcase the digital capabilities of the organization. They invest in huge budgets for IT. They hire a big IT team, and in fact, the budget sometimes get compromised with the manpower budgets and the biomedical equipment budgets, because the IT budgets we just heard are always, I think, the highest among all the budget planning. The organization has a lot of benefits. First of all, it is efficiency of processes, efficiency of billing and charging, transparency for all stakeholders, including doctors, other professionals, including patients. In fact, their reach to the public or communities is much higher. Their PR programs, the promotions, the immunization program, the marketing, everything gets a smooth journey. Data management, transparency, medico-legal aspects are handled better. Data storage, where they have to store huge files in olden times and pick up rooms within the hospital or warehouses, etc. Now it is all on the digital. So a lot of benefits. Also patient safety, infection control practices, the websites they have where they can have all the promotions for doctors, availability of information to the patients. All of this are huge benefits for the organization. It also helps the quality team in the hospital for managing the incidents through a real-time reporting, real-time analysis, no hiding of incidents, and also for other managers. Apart from the authorities, biomedical engineer, interfacing of biomedical equipments with the patient monitors, whether it is infusion pump or ventilators or anything else, the data is straight away available and you can't change or fudge the data. That's part one. The housekeeping gets huge benefit through digitalization, where the room status, the room, vacant rooms, availability of rooms, taking on admissions, discharge management, all of these processes get quite streamlined. The benefits are huge for the medical heads and the nursing heads. Huge benefits for the biomedical engineers, facility engineers, where BMS, temperature, humidity, everything is a click of the button. So the benefits are enormous for the organization. If I talk about the patients, I think in our country that has evolved in last few years. The patients are able to use the digital platforms. Of course, there is a absolute outflow of n number of apps, health apps, information, various platforms. But we know in our country, out of the 140 crore population, almost everybody starting with a 3 years old can access a WhatsApp, a mobile, the Facebook, the Instagram, and that's the easiest adoption we have seen, including our Sabziwala, the milkman. Everybody can use a platform. So for the patient, there are benefits of availability of data. They're reaching out to the hospitals for scheduling consultations, scheduling appointments. During the COVID, we have seen a greater use of telemedicine, which was launched years ago, more than 2 decades ago, but was not used much. So for patients, that is a benefit, access to report, taking consult through WhatsApp, through other platforms created by hospital, and having cross-referrals. Also, the patients can see transparency of information on the reports. There are patient apps, there are doctor apps. The orders are straight away available to the patients. So these are benefits for patients, and patients are also benefited by remote wearable devices, remote monitoring, home health care, where a patient is at home for a ICU. The doctor, the nurses, they can manage him remotely through the camera devices, etc. The records are available. Patient gets a huge benefit. Coming to the healthcare professionals, I think there are a lot of wins for them, but the success story lies if they understand what is in for them, especially our clinician friends, those who are from 20, 30 years experience and more. They are highly competent, they are very busy, they've got workload of patients. They feel this is another burden or another ghost, as just mentioned by you. I used to visit a couple of hospitals. I worked in 2 corporates, Max Healthcare and Columbia Asia. And Columbia Asia was known as a paperless organization. We opened hospitals in tier 2 cities, smaller cities, Ahmedabad, Patiala, so on and so forth. When I used to ask the doctors, what help do you need? The only help they wanted was stop this computer business. They said, why can't we write on paper? For 20, 30 years, I have written on paper. Probably they were not consulted. Their buy-in was not taken when the digitalization journey began. So if you want a success, it's highly beneficial to doctors. They have their data available, and they have an app available. They can prescribe sitting anywhere. They can send advice. They can order investigations. They can see report. They can see trends of reports. They can see their own performance scorecard, clinical outcome. Huge benefit. They don't have to go through a pile of files for patient record. The EHR is so efficient if well done. If well done, to be quoted. The IT teams which are creating these platforms in the hospitals, especially for clinical usage, have to think in mind efficiency and simplicity, not making it complex for clinical teams. In our country, we are already hard-pressed, shortages of manpower, doctors, nurses, our paramedics. Hence, it has to be simple, promoting efficiency by simple platforms which are easy to adopt, easy to understand, and their onboarding is done properly. There are huge benefits for doctors. For nurses, it is, I think, a fantastic platform. In both the organization where I worked for about 20 plus years, we have had seamless, paperless, digital platforms for nurses. They have found it extremely useful. The younger population, which is coming now straight from the colleges, adopt it in a jiffy. They need all about 2 to 4 weeks time to adopt the hospital HIS and all other platforms. It is also beneficial when you wish to train your doctors and nurses. There are learning management systems, there are online systems, and there are virtual simulation labs. People are coming without hands-on training from colleges, whether medical or nurses. Thanks to COVID, this still went down. So if you wish to train a person on a specific skill, procedure, surgery protocol, or process, you got virtual simulations. That's part of a fantastic digitalization when you wish to train people. I would say there are benefits for every single person in the healthcare system. Even a housekeeping staff who's an outsource has a tracking system, a porter tracking. We use RFIDs. You can track where equipment is moving, where people are moving, whom do you want to reach out, patients in the OT. Real-time updates can be sent out to the patients, the family members, and to the healthcare professionals. Where is the patient? On the operating table, in the pre-op area, has finished surgery, or it's going to take time, mass SMSs. I think I can go on for days and hours. I wish to stop here. There are huge benefits for every single person. You can take it in inverted commas. The system has to be designed well for adoption, not for complicating lives of people in the hospital. Thank you.
Thanks, Binu. You know what? Through my artificial intelligence, I was making it out from Dr. Vibhu that he's about to raise his hand. He wants to speak something.
All right.
I just read through my artificial intelligence. You know, it works. So, Dr. Vibhu, the question is for you now. Basically, I just wanted to understand. She spoke about the entire advantage for the people. Yeah. Every hospital has got 2 main factors. One is the patient outcome, second is the quality. In terms of the advancement of the technologies getting into the healthcare sector, what benefit do you believe can occur at these two places in terms of healthcare?
Yeah. So, first of all, Madam Binu Sharma has already raised so many benefits. But as we started using this technology from the time of COVID, what we have seen, it was a path breaker. I mean, how the reports came fast, and even after vaccination, we have seen how fast we were getting all those things. And after getting the benefits of all digital medias, whether like doctors, we are famous for their smart handwriting. So with use of EMR and all those things, incidences of medication error, even better infection rates, so many outcomes, they have become better. I'm proud to be sitting with the next to orthopedic surgeon. So like use of robotics, how it has changed. Like in my hospital, we bought that robotics, which was the first. I'm not doing any marketing for that, but just that particular robot, it has got the particular facility that it will not cut posterior cruciate ligament during the surgery. It will retain that. So what I have seen in last 15 months, we have done more than 1,500 surgeries, and how patient is going after third and fourth day. Patient are made to walk on the day of surgery in the evening, and after 4 days, patients are discharged. So that's a very good clinical outcomes what we can think of with the help of technologies. And of course, I also want to thank India government, like what we have done for even this Aadhaar card. Although we have got a lot of population, but still so many crores of this health record for Ayushman Bharat health account, they have been created. So in the future, that will be like everyone in the hospital, they will just come without any paper. So as you mentioned very nicely about the story of ghost. So it's a very good thing, a better clinical outcome, better average length of stay, better infection rates. And that's why a lot of emphasis is given to digital era. And I'm very happy to say that even the government of India, like the budget, what they are keeping it for, it is 4 to 5 folds. If you see annual, their growth rate based on that, but budget they are keeping, it will be around 24 to 25%. So that's the very important thing, how things are going to help in technology, in better clinical outcomes, and naturally that will help for better patient satisfaction.
Thank you so much. I think pretty well said. And I know Karan is sitting and itching to speak about something. So here comes your turn. So we spoke, we just heard so many things from so many people. Now we have heard from only from one side. Now I would like to come to you with a different type of a story. Like if we need to be at the level of healthcare professionals, what challenges or what shortcomings they may face with this upskilling into digitalization?
Yeah, I think that's a very important question, and a lot of the benefits have been covered, both the systemic benefits and benefits to patients and staff. Dr. Ashish covered some of the challenges that clinicians face. A lot of it, one feels at the systemic level, has to do with a lack of integration. There are different types of technologies. When we talk about the system, actually there is no the system. There are many systems which are trying to interact with each other. Your MRI software is very different, which a technician may know of. It's very different from your HIS, it's very different from your billing. There is a level of integration that has happened and some bits of bolt-on which is happening on existing software to make it more interoperable, but that remains a challenge. When we speak to clinicians, we often hear from them that, look, you're sitting in silos. I may do this bit, but it doesn't connect me to the IP, or doesn't connect me to the MRI, or doesn't connect me to the clinics outside. And more recently, we've heard it doesn't connect me to your telemedicine HIS. I think those gaps exist, and I think we as healthcare administrators need to look at those very specifically to plug. Also, the interoperability between systems varies when we are looking at international patients. And a lot of hospitals in Delhi and the metros get patients from overseas, and we may be keen to push EMR to them and offering them this as a differentiator. But when they go back to their own countries, they might have challenges accessing that data or with continuity of care. And third challenge remains that doctors are expected to be available all the time, 24/7. So if they are sitting at home, the easy way to get a report to them is through WhatsApp or through other systems. Very difficult to get them to go onto their systems, open that system and access it so that there is data patency. And one can appreciate where they are coming from. This whole 24/7 availability is a challenge for them. But I think as administrators, we need to be mindful of the challenge that our workforce faces in the adoption. And the other differentiation that I want to bring out is that we are talking about digital upskilling. One is to upskill ourselves using digital tools, and the other is to upskill ourselves about digital tools themselves. And there again, I think we need different types of approaches for different people. If it's a housekeeper, they have different digital needs. If it is a senior surgeon, he or she has different needs. And if it's the reception staff or patient-facing staff, they have different needs. Till the time we try to have a one-size-fits-all, we will continue to face these challenges. And I think it's a work in progress, but remarkable progress has already been made, accelerated during COVID. And in the years ahead, there is now a conducive regulatory environment to push people to adopt. The good part is digitalization was a differentiator for hospitals. They used to talk about it. Today, it's the norm. It just shows the road that we are on.
Thank you so much. I think pretty well said. So this brings me to Mr. Ashish Shukla. The challenges which he just spoke about, what do you think could be the solutions for it? If there could be any specific suggestions from your side, how this can be resolved for the people who are the users?
Thank you for...
You're audible.
Thank you for giving me this opportunity. We are here to discuss this digital upskilling. So I would like to say, according to some World Economic Forum reports, it says that in next 3 to 4 years, around 30 to 40% people would be requiring some kind of upskilling or reskilling in their domain areas. So as Dr. Karan rightly said, it's a new normal, you can say. You need to upskill and you need to hone the skills, digital skills, as far as the clinicians are concerned, paramedicals are concerned, nursing staff are concerned. And also WHO says involve everyone in this digital learning skills. So right, everyone who is involved in the healthcare ecosystem. Secondly, also we need to see on a healthcare professional or healthcare provider or worker perspective, there are two phenomena which we can say, the buy-in approach and the capacity to learn actually. So if a person if an employee or maybe a healthcare worker, doctor, nurse, if he believes that this skill or this learning would going to help in their current role, or maybe it's going to help in the overall organization success, so that makes task much more easier actually. And secondly, we as a managers, we need to handhold all those employees, all those frontline workers in upskilling process actually. It's a long process, it's a long journey actually. You need to send some benchmarks also, some KPIs also to see the digital initiative results, outcomes, how we are going to move ahead in those lines actually. And foremost importantly, we need to start a culture of actually digital, in the organization actually. So it has to be cascaded down from the top management with a clear vision and everything. If I say, if I talk about my organization, definitely we started some digital transformation a year back actually. In the previous sessions, we were talking about, making a data lake and everything. So we created a data lake. Now we have a data lake. We can design, we can create different cohorts of different diseases according to the demographic, according to the disease pattern. And now we are able to connect with our patients. We have introduced a chatbot thing which helps us in tracking the patient's disease journey, how they are visiting the hospitals, about their vaccination, immunization, chronic conditions these days like cardiovascular diseases, hypertension, diabetes. So these are some of the parameters which definitely giving a boost to this digital. It's not like that digital was never existed, but still in India, if you say like 40 crores of Indian people are using digital means by some or other means like maybe online, buying the pharmacy medicines, going for the online test, taking the telemedicine consultation, or maybe interacting on a virtual support group. So it's still there, but it's a long journey to go.
Yeah, that's right. So, Kawaljeet, you have been into the force in the sense that you are leading the most important force in a healthcare, which is the nursing force. And I think this entire talk about the digitalization brings us to a very important factor in healthcare. Healthcare is all about empathy. It's all about human connect. Do you think this could be compromised if there is complete digitalization of the healthcare systems?
Very important question. I think nobody can replace a human being. Even if we get into digitalization, it should be more for your improving your processes, streamlining your automation, but no one can replace a nurse or a doctor who will hold the hand of a patient and give a beautiful smile. I think empathy is all about connect with the patient. So if we talk about digitalization, but digitalization should be done on those aspects which will improve your efficiencies, which will improve your productivities, which will give you data. That data will speak to you and that will give you data-driven decision making. It will help the management or the managers or the nursing managers to pull down their data-based reports. It will tell you the real-time factors where you're going wrong and what are you doing. But when it comes to direct patient care, human touch and human-centered approach is very important. So that is really, empathy is very important, but digitalization will help you in improving your patient outcomes, like one of them has said, and improving your quality, improving your outcomes. It will help you in collaborating and communicating with other departments because it becomes easier for you to collaborate with your other stakeholders, like for example, billing activities or quality, like you are using incident reporting, like Binu had mentioned earlier. When we were in the paper processes, it becomes very difficult for us to, track all the incidents. But now with this new software which is coming in for quality management system, I think it becomes very easy for us to put our incidents and put all the causative factors. And when the data gets analyzed, it will give you exactly what you are going wrong, where it is you are going wrong in that. So I think digitalization is important, but it cannot replace your human touch, human factor. So empathy and compassion is very important. Digitalization can help the healthcare providers in patient empowerment. So you can empower your patients, you can teach the patients how to use these digital tools, their self-evaluation or the self-management. They can get into the mobile apps or the health apps, or you can teach them how to, manage their chronic conditions. So that way you can teach the patients how to read or how to get this digitalization benefits for themselves. So that is really very important for the healthcare providers. And the third thing is definitely another thing about this empathy is you have to upskill your staff. So when you're upskilling your staff or your nurses or your providers, you have to, collaborate with the academic institutions or the industry partners, and you tell them how to teach the nurses, like remote monitoring devices. How do you use the remote monitoring devices? One of the typical example is your patient managed analgesia, PCA pumps. It's a digitalized tool, it's a equipment, but you teach the patient how to use that for their own pain management. So there are a lot of tools and equipment and digital apps which are used, but to benefit for the patients, for the employees, for the organization, but not to replace the empathy power of that. So I think that's really important.
Thanks a
Actually, I
lot,
may
and I
add
think-
to it, Dr. Kousar, the efficiency of digitalization will free up time for nurses to spend more at the patient bedside to improve the human connect or the touch and the empathy part, actually.
Very well said.
Yeah.
So when it comes to empathy, I mean, we have Dr. Ashish, who I've seen very closely practicing this day in, day out, the empathy and the human connect. And I would like to again request Dr. Ashish to put some couple of pointers on this very important aspect from the healthcare perspective.
In fact, I was itching at that time to continue this, touch
I
upon
could
those.
again use my artificial intelligence that itch was
So
visible.
there are three things. One, definitely is the power of human touch, which in the rut of going more and more digital, sometimes in my OPD, I am held back by one of our senior citizen that he says that, Doctor साहब आपने मुझे हाथ तो लगा के देखा नहीं, आप तो कंप्यूटर की तरफ मत देखिए. Sometimes they say, सर लिखने से पहले मेरे को examine कर लो. So people also know that doctors are, into the system. They start writing about the problem and the medicines, and they forget to touch the patient. So that basic, you can say relationship between a doctor and a patient, the power of human touch for a physician to actually examine, it is very comforting for the patient that at least they have felt what was the problem, and it also got reflected once the COVID got over. The amount of teleconsult happening thereafter has dropped down significantly because everybody wanted to go out, just like they wanted to travel the world. They also wanted to go out to the hospital, meet the doctor, let them examine, give us the right treatment. That was a compulsion. They were not able to do that. The physical interaction was missing, but now they are reaching to go back to the same. So there is something which always should be supreme for clinical care. That is the power of human touch. Empathy, yes, definitely no robotics, no system can actually quantify it or make it happen through an algorithm. That is, and thank God robotics have not gone to that stage. Otherwise, all the physicians, surgeons will go out of business very soon. So that factor, it's something which is going to stay inherent to a human mind and heart, and it's continue to. But if there is a blend of that empathetic physician and along with the technology backup, I think that's the killing combination. And the last thing, one has to know where you have to overrule the technology. So very great example is for the robotic, what Sir was mentioning. So first few of my cases on robotic, if I was following the robot, it was leading to a mess. So surgeon has to know where to follow the technology and where to follow the experience. A very fine example, a similar example, I can draw from one of the movies, Sully by Tom Hanks, where he was penalized by the board that you could have landed safely. If you had decided, you got to know that there is a problem in the flight, you could have landed because the simulator is saying that you could have landed on the ground. Why did you land on the water? So only a matter of 38 seconds which he took before diverting. So that 38 seconds was not added to the simulation. The moment the board added 38 seconds, which was the time which a human mind took to take a decision and analyze on the experience. After 38 seconds, the simulator also crashed the land. So led to a crash landing. So that 38 seconds of human experience, the mind made the difference and he was saved from the penalization.
That's a great story, in fact, to hear. So this brings me to the last query, which I would like to put to Dr. Ashutosh, actually. Do you think that combining the educational institutes, technological companies, and the healthcare organizations on the same page can fasten this distance to be traveled to completely become digitalized? We have already been shown the red flag by the organizers.
Yeah, it's only 2 minutes.
Yeah.
Nothing like for me, but only talking about the practical experiences. 20 years back, then when there was no digitalization, if any doctor used to see the record and see pulse 120 or 140, they used to ask about AF and VF. Now the thing is, if it is written 140 or 120, they can trace the ECG tracking what has happened actually. So this is the thing what we have achieved. And secondly, about all these things, robotic surgeries and all, means because of robotic surgery, tumor surgeries is a daycare surgery now. So now clinical research is another factor. Then there are more things which has been enumerated. So it's all.
You want to say something?
Right. Can I add on to what
Yeah,
Dr.
I mean,
Ashutosh
if
said?
the organizers allow, I have no
Fine.
issues.
No. So it's collaborating between the service and academics, the colleges and the teaching institutions and the practicing hospitals. The students come for practice, but they are not allowed to touch patients. There are norms and regulations. So bringing them, adopting the tech-savvy hospitals are becoming more and more attractive. They are actually a matter of status concern for the tech teaching institutes to be associated by such hospitals. So in nutshell, we should promote, because technology is still not got any place in the curriculums, in the academic syllabus, which are being taught. So obviously, the healthcare organizations have to step up in adopting these institutions, teaching them, collaborating with the students and because they are the ones who have to get job ready to take charge from us. So of course, we owe this responsibility towards them.
Thank you so much. I think let's come to the end now. So, I can actually go on and on discussing this topic, because this is such a beautiful topic, such an interesting topic. But the point is, we need to still draw the curtains. In terms of digitalization, I would like to say from the management's perspective that there are three major aspects which we all have been missing as of today, which initially I spoke about the ROI is not happening. Now, if I need to divide the ROIs under three big headings from a C-suite perspective, I think it is the technological advantage that can come from the digitalization, which is still not fully achieved. It is the operational excellence, which again can be a huge advantage for any organization who actually does it pretty well. The third can be even the strategical advantage, because these three, any organization can actually achieve if they really, really shift 100% into digitalization. All that we discussed here, if these are actually taken into course and taken into implementation level, with the help, of course, with the technological companies, the healthcare will see a different world faster than the imagination. With these lines, I would like to conclude, and I'm sure, any fine for overshooting the time? That's what I'm saying. Any fine for that? For overshooting the time? Any fine for that? Okay, thank you.
Can you have a huge round of applause for our excellent panel discussion, excellent panelists, for giving us insights on digital upskilling, health workforce for the digital future, and also touching base upon various aspects of digital transformation. What are the challenges, what are the opportunities, and what can be the way forward. Thank you so much, Dr. Kousar Shah, Dr. Ashish Chaudhry, Dr. V.R. Gupta, Dr. Karan Thakur, Dr. Ashish Shukla, Colonel Binu Sharma, Kawaljeet Oberoi, Captain Sandhya Shankar, and Dr. Ashutosh Srivastava. Thank you so much. I request Dr. Kousar Shah, since you are the moderator of this session, to kindly hand over token appreciation to your fellow panelists, and then we'll also give you that token appreciation. So can we have that on stage, please? We can start with Dr. Ashish Chaudhry, Managing Director, Aakash Healthcare Private Limited. A huge round of applause for him, please. To Dr. V.R. Gupta, Group Medical Director, Sarvodaya Healthcare. To Dr. V.R. Gupta, yes. To Dr. Karan Thakur, Group Lead, Sustainability and ESG and Vice President, Indraprastha Apollo Hospitals. Dr. Karan Thakur. To Dr. Ashish Shukla, Vice President Operations and Strategy, Regency Healthcare. To Colonel Binu Sharma, Senior Director Nursing, Max Healthcare. To Kawaljeet Oberoi, Group Chief Nursing Officer, Paras Health. Captain Sandhya Shankar, Corporate Chief of Nursing, Fortis Healthcare. And to Dr. Ashutosh Srivastava, Medical Director, Aditya Birla Memorial Hospital. I request Sangamitra Mohanty to come on stage and hand over token of appreciation to the moderator of this session, Dr. Kousar Shah, Senior Vice President, Max Healthcare. Thank you so much, all of you, for joining us today. That brings us to the end of the 6th edition of National HealthTech Innovation Conclave, organized by APAC News Network, presented by Iron Mountain and powered by Schneider Electric. Also, I'd like to thank our other partners, gold partners, Cloud4C, Ruckus Reddington, Associate Partner, Trimid, NGO Partner, Willing Happiness, and supporting partners, National Health Authority, Heights and HCC, and of course, country partner, Embassy of Sweden, New Delhi. And we also now have to announce 2 lucky draw winners who have been part of this conference since morning. Hopefully they both are delegates. Are here also, yes. So the first name is Shikha Rampal, Head of Operations, CK Birla Hospitals. Is she here? Okay, we can find then another. Seema Yadav from CK Birla Health. She has also left. So both of them are the bad luck. And Arun Kumar Sa from Paras Hospitals. He is here. So one more we can. And one more name I can announce because 2 have been rejected. So Tanisha Raheja, Deputy Manager, Max Healthcare. Yes. So yes, she is here. So Max and Paras are the winners of the lucky draw. Thank you so much, all of you. Do join us for an interesting event on the government sector, which APAC is organizing on 11th and 12th of August in the beautiful city of Bhopal. That's the 4th edition of APAC's India Digital Empowerment Meet and Awards, Madhya Pradesh edition, hosted by the Department of Science and Technology, Government of Madhya Pradesh, and organized by APAC News Network. Do join us in that conference if you have any interest to reach out to the decision makers in the government ecosystem. Thank you so much. With this, I'd like to invite Neha Pal from APAC Healthcare to give vote of thanks. And then I'll request all my APAC colleagues to come on stage for a group photo as well. Thank you so much. Goodbye. Take care.
So as we draw close to on this remarkable National Health Tech Innovation Conclave, I would like to extend my heartfelt thanks and gratitude to all the speakers, delegates, and the partners who have made this event a grand success. This event would not be a success if I'll not appreciate the team who was working behind this conclave from last 2 months, and they need, it is the time to, extend my heartfelt gratitude and, appreciation towards them, starting with Nikhil Lakhera, Shrishti Bharti, Neha Sharma, Alice Purti, Ritu Sharma, Suman sir, Sanjay sir, Rajneesh sir, Rahul Kashyap, Piyush and Chirag. Last, certainly not the least, the 3 pillars of APAC News Network, Souvik Goswami, Sangamitra Mohanty and Gopi Krishna Arora, because without their leadership and guidance, this conclave would not have been possible and even a success. Thank you so much. Keep supporting us and keep guiding us. Thank you.